Hey guys, welcome back. In this video, I'll be talking about patient exposure. Patient exposure is hands-on interaction with patients in a healthcare setting. It's been said that if you're close enough to smell the patient, then it counts. To get myself through undergrad, I had to take out loans and I had to work. I'll talk about loans in another video. One of the jobs I had during undergrad was at a plasma center. I was a donor processor. Really all I did was take a brief medical history of people who wanted to donate plasma. I'd do a hematocrit of their blood, and then I'd check their albumin levels, and that was really it. That's all I had to do. I did that full time for 6 months, took a semester off. I don't really think you have to do that, but just with my circumstances, that's what I had to do. And the job worked out for my circumstances because it didn't really require any training or certification, anything like that. And there was a lot of turnover at the job, so the job was fairly easy to get. It fit the definition of patient exposure, even though it wasn't a formal healthcare setting. Some other jobs to get patient exposure are EMT, ER scribe, CNA, phlebotomist, surgical tech, medical assistant, patient transporter, and the hospital diet, the guy that brings the food to all the patients. I've heard that counts as well, and yeah, that makes total sense. Some jobs that might not classify as patient exposure are things like pharmacy tech or secretary. Although a secretary, depending on your job responsibilities, it might count. Some people really want to count pharmacy tech as patient exposure, but I wouldn't do that because with patient exposure, you really want to test yourself to see if you can work around sick people for the rest of your life. Patient exposure is probably one of the big five that requires the most planning. It also has the most overlap between a lot of the other components of the big five. For example, doing something like clinical research. A lot of people will count that as patient exposure. A question you might have is, can I combine my hours? Like, if I'm doing clinical research, can I count that as research? But then can I also count it as patient exposure? Some schools directly say no, but some schools don't say anything about it. The difficulty of doing it is that AMCAS only allows you to assign one category per topic. And so with the amount of space that you have available to talk about it, it might get kind of hard, but if you make it one of your most meaningful experiences, then you'll have a lot more characters to work with and explain it a little bit better. If you have some good ways of getting patient exposure, let us know in the comments below so everyone else can see. Thanks for watching.